Hi, 7th graders. Today we're starting 6.4, Infectious Disease and Your Health, and we're going to start with an introduction to immunity. So how does immunity work? We're going to review what are your body's lines of defense. We're going to learn how the immune system gets triggered and how the first response immunity differs from the second time you get infected. And how do people become specifically immune to certain diseases? So just as a review, there are 3 lines of defense. The first is your external barriers, like your skin, your mucous membrane, the good bacteria that live on the outside of your body and fight the bad bacteria, the saltiness of your skin, the chemicals that are in your eyes that keep pathogens from growing there. Your second line of defense, if a pathogen gets past those, is the inflammatory response. It's your body fluids, it's your white blood cells when they first encounter something. And then the third line of defense is your immune response. So when your body starts building antibodies and fighting the pathogen. So how do we start the immune system? And how can you become immune? So let's talk about why some people get diseases only once. Well, you can develop something called immunity to disease. And of course, it depends on the disease, but you can become immune from chickenpox or smallpox. How does that happen? Well, there's 2 major types of immunity. Immunity is just the body's ability to destroy pathogens before they can cause disease. So basically recognize them and take them out. This happens through active immunity, so either having a vaccination or getting sick and building up those antibodies, or through passive immunity, which just means picking up antibodies from somebody else. So let's start with active immunity. This happens when the body makes its own antibodies in response to an antigen. Remember, antibodies and antigens are both proteins, not cells, so don't get those mixed up. Right? They're much smaller. They're just a part of a cell. Okay? So antigens are proteins that are on the outside of a cell, like a bacteria cell, for example. Antibodies are sort of the opposite of those antigens. They're also proteins, but our body makes them to recognize the antigen so that they sort of bind together, and then that signals the cells that, oh, this is a pathogen, we need to destroy it. So in addition to the antibodies, your body will also produce something called memory cells. And these will have antibodies and other features that allow them to remember the pathogen for a long time. So one way, right, to have active immunity is by getting sick. So the pathogens invade the body, right, and they multiply, whether it's a bacteria or a virus, and they multiply differently, but they both do it. The immune system recognizes that something is wrong right away, and it will start to recognize things and build up antibodies against it. If your body is successful the first time, you'll start to feel better. You'll get better. And then some of those antibodies and memory cells that your body made will stay in your blood. So that if you get sick a second time, they'll activate and they'll take out that pathogen much faster. So why can we be reinfected by flu virus? So basically what I just explained was that if you've been sick from something once, the second time you get it, your body will recognize it and take it out right away. But the thing with flu, and there's many reasons why you can get reinfected, but the most important one is that the flu you got this year or last year is not the same as the flu you're going to get the next year. It changes over time, it evolves, it mutates. And so the antigens are going to change, and so your antibodies may not recognize it. And doctors do their best to produce flu vaccines that will recognize the right type of flu for that season, but you have to get them every season because the flu is different every season. So let's talk a little bit about those vaccines. You can kind of think of them like a wanted poster, right? So the doctor gives you the vaccine. The vaccine has sort of parts of the pathogen. Your body recognizes it like it would recognize a wanted poster. And then when it sees the real pathogen, it'll recognize it and say, hey, you're not supposed to be here. You're a pathogen, and it will attack it. So let's break that down a bit. Vaccination, sometimes called immunization, is the process of giving a vaccine by injection or by the mouth. And sometimes they use nasal sprays too. And this starts the specific immunity. Basically, a vaccine is just a dead or weakened specific pathogen or a part of a pathogen, the antigen. This actually really helps to reduce childhood diseases. There are many that no longer exist because we've developed vaccines against them, like polio, measles, mumps, rubella, tetanus, and many more. So how does it work? Like I said, you basically inject a weakened or killed form of the disease. The body sees it and starts to make antibodies that will react to it. And then when you get the real disease, something that could actually be harmful, your body already has antibodies and it already has memory cells, and they'll just multiply, right, make more and more to fight off the disease before it ever even makes you get sick. So that's called a first exposure, right? And the first exposure happens slowly because the defenses all have to be created, right? So on the left here, we see a vaccination, okay? So basically what we have here is like a part of a pathogen. So this is a little part of it, right? An antigen. Your B cells, right? Remember those are one of your white blood cells, will recognize it and it will start making antibodies and will also produce memory cells. And this happens slowly, but they'll stay in your blood so that the next time you get infected, right? The next time you get infected, they'll recognize it right away and produce many, many antibodies. The other way first exposure happens is, like I said, by getting sick, infection, right? So if you can live through a virus, right? Let's say it's not too bad and you get better. That means your body will have antibodies already built up because it works the same way a vaccination works, except for more harmful, right? Your body recognizes the antigens. It starts to build up memory cells and antibodies to attack it, and those stick around in the blood. And because you've already been exposed, when you get to the second exposure, it happens really fast because your body has already built some defenses. So let's take a look here, okay? Note that a second infection of the same pathogen results in a faster response with more antibodies produced. And that's just because for the first one, look at this lag period, you don't have any antibodies ready to go. Well, the body has to make them and it takes some time. So it's not until about 16, 17 days when you have enough antibodies to actually successfully fight off the pathogen. But notice that some of those stick around, okay? And so if it happens again, you already have some in the reserves, and those can be built up quickly for the secondary response to fight it off. So that's it for today. Make sure you complete all of your assigned work, and make sure that you answer the attendance survey. Students have been forgetting to mark their attendance lately. Next time, we're going to learn about preventing and treating infectious disease.